Hi, everyone. Thanks for being here today. My name is Helen Wick.
And my name is Maya, and today we are here on behalf of our Impact MBA team. Let me ask you this. Have you ever skipped a doctor's appointment because you were simply too busy with work or just didn't feel like driving another 20 minutes to a doctor's office after a long workday? Chances are you are not alone. Especially low income communities face issues such as time constraints and money constraints to address critical health care concerns, potentially leading to long term health implications. In the United States alone, about 30% of the workforce earn less than $15 an hour. Not even one third of the low income workers obtain health insurance through their employer. And Mississippi continues to score lowest on the health system performance score. So workers in Mississippi are earning way below what is needed to afford quality health care, including people like Lisa. Lisa is a 34-year-old Walmart employee living in Mississippi and working two part-time jobs. Her wage recently increased to $10 an hour, but does not provide her with health insurance coverage. Lisa was recently diagnosed with high blood sugar and a pre-diabetic stage, but she can't seek medical help due to her long working hours and cost constraints. The solution to Lisa's challenge is expanding Optum's current mobile clinics and existing partnerships. So these mobile clinics will be sponsored by corporate employers such as Walmart and other big box employers and deployed directly on site. Employers are thus improving the health of their workforce, increasing productivity, and lowering overall insurance costs. By opening up the service to community members, they can also further boost their CSR efforts. These mobile clinics will provide scalable primary and preventative health care, addressing accessibility and affordability issues of low-income communities. These mobile clinics will be scheduled to visit employers' worksite on a regular basis and for workers and other community members to access. They will operate 6 days a week, 10 hours a day, providing care for approximately 60 patients a day per mobile clinic. They will be staffed with 2 social workers and 2 family nurse practitioners, and they will have 2 sets of staff on rotation. Proactive vehicle maintenance once a month will also ensure continued high-quality service and reliability.
The benefits of this approach solve the challenges of accessibility, affordability, and time constraints that Lisa and the community at large experience. It takes Optum's current approach and reduces its size and capacity for daily operations and deploys the larger and more specialized vehicle for monthly visits that would require referred care otherwise. Optum can adapt the healthcare services provided based on the needs of the community. Mobile clinics result in an average of fewer emergency room visits each year, translating to an average savings of a fifth of the cost of care. Mobile clinics also provide cost-effective prevention services that reduce the amount of care an individual needs over their lifetime. Patients visiting mobile clinics reported feeling more empowered to navigate the broader healthcare system. Also, startup costs are significantly cheaper for mobile clinics than they are for brick and mortar clinics. These mobile clinics provide high quality care that is flexible, local, and accessible. Some of the risks associated with this model are related to challenges finding culturally competent employees, especially considering the high attrition in this space due to high stress and compassion fatigue. There's also fragmentation from the broader healthcare system and referrals. In order to mitigate these risks, it's important to have strong resiliency training, mental health support, and manageable schedules for the employees, and build strong relationships and systems to connect patients with other services. Based on our projections and corporate sponsors, We project around $2 million in revenue in the first year. In the third year, approximately $11 million of revenue. And in the fifth year, nearly $17 million in revenue. In order to achieve this, Optum can implement the timeline of, in the first year, having one mobile clinic serving approximately 17,000 community members. In the third year, having 5 mobile clinics serving 86,000 community members. And in the fifth year, having 10 mobile clinics serving about 172,000 community members. We recommend entering in the market in Lisa's state of Mississippi. Mississippi has the highest healthcare gap in the United States, has a low minimum wage, and a high percentage of hourly workers. There are nearly 500,000 low-income patients in Mississippi alone. To successfully achieve this, it requires branding, outreach, and strong community relationship building. In order to achieve this model at scale, we recommend increasing the number of mobile clinics across the United States, especially in states similar to Mississippi, such as West Virginia and Oklahoma. It also would be maximizing current partnerships and corporate sponsors and expanding it into other existing markets that Optum operates in, such as India and Brazil. This corporate sponsored mobile clinic can provide quality care to communities like Lisa's across the globe. Thank you.
So who would you sell it to? Who's going to pay for it?
Yes. You want to answer that?
Sure. So, considering that you have a burgeoning partnership with Walmart, this was our target primary consumer, based on an estimated daily sponsorship rate of 8,500. But this can also be expanded to Target, to McDonald's, anywhere there's a strip mall in the country. We can find a partner or conglomerate of partners to sponsor us.
And you're targeting Medicaid, Medicare, mostly members?
So that's something we had discussed, and we'd be open to feedback on that because, acknowledging that this does, at least the way we've presented it, of it serving the community that is employed by, say, Walmart, but we want to have access to the broader community as well. And we don't know if that would be included in this sponsorship, if people outside of the community pay a sliding scale, just because we are targeting low-income communities. And one reason why we want to have a social worker on hand is that a lot of times low-income communities don't know what they have access to. And so it could give them the opportunity to get on Medicare or Medicaid if that's what they need in order to get more services.
So if Walmart is your sort of sponsor, mobile clinic shows up, parks in the Walmart parking lot. Ideally, the Walmart employees can go and take advantage of that service, but also the community members who are shopping at Walmart anyway. And they're going to pay the,
But then you'll charge them.
You'll charge them, but you won't charge the Walmart employees because it's their corporate that sponsored it, right? Something like that.
Yeah, something like that.
Yeah.
And it also kind of feeds into like why this would be beneficial for Walmart is they do have their health centers and people pay to use those health centers, and they don't have to have all of the costs that are associated with a retail space and just have the mobile clinic. And then, one of the issues with low income communities is that even if you say they have issues, they still don't have the time to go and see a doctor. And so that's why we say reduce the capacity that Optum's currently operating at, and then just send that out monthly or something like that.
Oh, so you're looking at saying to Walmart, you don't have to build your clinic. We'll drive our clinic into the parking lot. So you save on that cost, and then send your employees to me.
Right.
Got it.
Where'd you get the 17,000 per van? Is that visits per year or?
On which one?
For the daily operations
yeah.
you're referring to. So that's based on a partner that some of the team is currently working with that has a mobile vaccination clinic company. Their operations are $17,500 per month.
60 patients a day. That's a lot of patients.
That's a lot of patients. That's taken from an average that we've gotten from mobile health maps, 20 minutes per patient. So obviously some will be more and some will be less. That's where the 10 hours gives us a lot of space, and we're rotating our staff on a 3-day basis. Even though we have longer days, this will allow us to see more patients and prevent burnout.
Base it on a vaccine model, because that's like,
Yeah, this is not based on a vaccination.
Not based on vaccine.
This is based on other mobile health clinics that operate currently in the U.S.
So for example, in Mississippi, there is currently one mobile clinic service operating, but they are very targeted to visiting only one community a day. So they're still very low scale.
But you would partner with a business like a Walmart or somebody, and this become an employee benefit, basically.
Employee and community
And
benefit.
yeah,
Yeah, but one thing that's really nice about this model is that it can be adaptable and scalable, and there are other sources of revenue streams as well. So,
Is there any concern, sort of from a confidentiality, privacy standpoint, just because, like, you know, you are watching all your coworkers go see doctors and vice versa? Like, I don't know, is there any, I don't know, data on that or anything you've come across about something like that being an inhibitor to uptake?
absolutely. So that is something that is really important to work into this model, into the execution. It is one of the flaws of mobile health clinics. However, it's something that can totally be done, and Optum has the skills and experience to navigate something like that. So the first year would definitely be working out a lot of those kinks.